Hello, this is Beta Blocker Buddies channel. We are biology students Han and Yuki, aiming to introduce science to you in a fun way.
For this video, I'm going to give a brief introduction about the cervical cancer. The cervix is where connects the uterus and vagina, acting as the door to the uterus, which sperm can travel through to fertilize eggs. Cervical cancer occurs when cells in the woman's cervix change, which includes unregulated cell proliferation. Deeper tissue of the cervix can be affected, and the cancer can possibly spread to other parts of the body, often the lungs, liver, rectum, bladder, and vagina. At this point, you may be wondering how to test for cervical cancer. Two screening tests can be performed, including PAP test and HPV test. For PAP test, doctor will scrape and brush cells from patient's cervix, and the cells would undergo lab examination for abnormalities. For HPV test, the tissue collected from the patient's cervix will be tested for the detection of any types of HPV presence, as certain types of HPV virus increase the cervical cancer risk. For younger women, PAP smear test is suggested. The HPV test is suggested for women about 30 or older. It usually takes 1 to 3 weeks to get your test result. The PAP test and HPV test are only screening tests. If the patient gets abnormal HPV test or PAP result, she needs to do more testing to see if a cancer or precancer is present. These further testing methods include colposcopy, endocervical scraping, and cone biopsies. There are two common types of cervical cancer. The first one is the squamous cell carcinoma, which forms in the lining of your cervix. 90% of the cervical cancer lies in this type. Adenocarcinoma, which forms in the cells that produce mucus. Cervical cancer stage ranges from stage 1 through 4. As a rule, the lower the number, the less the cancer has spread, and within a stage, an earlier letter means a lower stage. Cancer with similar stages tend to have a similar outlook and are often treated in much the same way. There is a rare type of cervical cancer called embryonal rhabdomyosarcoma. If you are inherited with damaged DICER1 gene, you are at high risk of getting this. Most cervical cancer is caused by the HPV infection. HPV is a group of viruses, and there are more than 100 types of HPV, of which at least 14 are cancer-causing, known as high-risk type. Two HPV types, type 16 and type 18, cause 70% of cervical cancer and precancerous cervical lesions infections. HPV is mainly transmitted through sexual contact, and most people are infected with HPV shortly after the onset of sexual activity. Cervical cancer symptoms include blood spots and light bleeding between or following periods, menstrual bleeding that is longer and heavier than usual. If the individual has started having sex before age 16 or has multiple sex partners, have took birth control pills especially for longer than 5 years, has a weakened immune system, or has a sexually transmitted disease, they will be at higher risk of getting this cancer.
Now let's move on to the treatment for this cancer. It is important to know that smoking increases the side effects of treatment and can make it less effective. If you smoke, you should stop. The treatment option depends on the stage of the cancer, the type of the cancer, the patient's desire to have children, and the patient's age. There are many treatment options for the cervical cancer. I'm going to introduce the radiation therapy. External radiation therapy uses a machine outside the body to send radiation towards the cancer. Certain ways of giving radiation therapy can help keep radiation from damaging nearby healthy tissue. Internal radiation therapy uses radioactive substances sealed in needles or catheters that are placed directly into or near the cancer. The side effect includes fatigue, upset stomach, diarrhea, nausea, and skin changes. What we can do to prevent the cervical cancer. Before girls have sex for the first time, the HPV vaccination is a best prevention effect which can prevent 17 to 90% of cervical cancer. There are two HPV vaccines available in Canada, HPV-2 and HPV-9. Men can take the HPV-2 vaccinations. It prevents 78% of cases of anal cancers in men caused by the two main types of HPV.